Okay, I think it's recording, so
Great.
we'll start. So hello everyone. Today we have Daniela Ho Tan here to chat about her workshop with us, East Meets West, Integrating Culture into Schema Therapy Practice for Asian Heritage Populations. And this is from her Project Horizen. But just to introduce Danny is a Vietnamese Australian clinical psychologist, advanced accredited schema therapist, board approved supervisor, and PhD candidate based in Sydney. As a proud member of the Asian diaspora and self-identified third culture kid, she brings a deeply personal understanding of cultural identity to her therapeutic work. Danny is presented widely on the intersection of culture and therapy, and she was the first Vietnamese psychologist to complete advanced schema accreditation. Her Project Horizen, began as a personal passion project and has since grown into a platform offering culturally responsive training, clinical supervision, coaching, retreats, and research online, both Australia-wide and internationally. The project was born from Danny's desire to create spaces where culture is not an afterthought, but a core part of the conversation in mental health practice. Thank you so much for joining me today, Danny. It's a pleasure to have you here.
Thank you so much, Marcus. I'm so delighted to be here to speak with you today.
Just to get started, could you tell us a little bit about what schema therapy is and perhaps like what kinds of clients are most suited to schema therapy?
Absolutely. So, schema therapy is a therapy that was designed by Jeffrey Young, who is a psychologist in the United States. And it originally started out as a treatment for people with borderline personality disorder. So, just to give a bit more context about the therapy itself, so schemas, I guess a lot of people call them core beliefs, but essentially they are representations that encompass thoughts, feelings, behaviors, bodily sensations, and memories that link in to, I guess, experiences that you would say are shaped by the way you view yourself, the way you view other people, the way you view the world. So, all of these schemas form and are related to our emotional needs. So, every human has a need for love, acceptance, safety, belonging. So, there's this idea of these universal needs. And when these needs aren't met, and usually this is in the formative years when you're as a child, and the expectation is the needs are met usually from attachment figures like your parents. So when the needs aren't being met, it forms into some of these maladaptive schemas. So, for instance, a child who didn't have a lot of nurturance and love and guidance might have developed an abandonment schema in the sense that they feel that there's no one there to support them or people always leave. Or they might have what's called an emotion deprivation schema where they don't know how to express their emotions because that was never shown or taught to them. So the schemas develop, and then as a result of that, there's this idea of modes, which I guess the simplest way to define it is like um, different emotional states, so different states that you go through. So we have our more vulnerable states, we have the more self-critical states, the coping states, and all of it gets activated when something happens that pushes us on our schemas. So the way that we see ourselves, others, and the world. So the therapy itself was developed as a way to treat and help people with borderline personality disorder who typically would come up on almost all the schemas. So there's over 20 in total. And so a big part of the therapy is about linking our current everyday life experiences to the earlier life experiences that might be quite triggering or activating. And the therapist will go in and support the client through understanding their schemas and modes, and then working through some of the, I guess, unprocessed memory. So often it's a lot of trauma work. So we do a lot of techniques that are quite experiential. So imagery scripting, where we go back into the earlier life memory and try to shift the meaning and help the client process what happened, advocate for their needs. So whilst we can't physically go back in time. We can go back to reshape the memory. And then another core element of it is chair work, where we actually use chairs placed around the room to help give voice to different parts of the client, to the different modes, and help them to separate it out. Because when there's so many conflicting thoughts and different states that people go through, it can be quite overwhelming. So being able to separate them out helps the client to make sense of their experiences and what they're going through. But at the end of the day, it's about helping support the client in meeting their needs and having very healthy, sustainable, supportive relationships in their life. And there's this idea of the healthy adult, which is a part of you that recognizes what needs require meeting, and go out and source that and allow you to function as a healthy adult in day-to-day life. So that's a little bit of a crash course into schema therapy. I think what I notice is almost actually all of the therapeutic modalities that are taught to us in psychology all come from the Western world. And in fact, it's a big part of my research. So 96% of psychological research comes from weird countries. And for those who don't know what weird means, it stands for Western educated, industrialized, rich, democratic countries. So Australia, America, many parts of Europe, the UK, though that's weird, I guess, weird countries, which only represent 12% of the world's population. I think it's really interesting that 96% of the research we do comes from, and that we're teaching in psychology as this evidence-based gold standard of treatment is based on 12% of the world, population sample
Yeah.
size. So that just blows my mind.
I know. It's
And that's a
like
big
that's
part of
actually the minority.
exactly. We're the global majority here,
Yeah.
but there's not a whole lot of research. It is getting better. I don't know what the up-to-date statistics are. I think that statistic I mentioned is from maybe 2012. So it's been quite some time. But even just in the reason why I went back to research when I swore up and down I would never go back to uni was because I saw this gap. And so I'd been working for probably 12 years as a psychologist and seeing so many Asian clients and recognizing that what I was taught didn't always apply, kind of like it didn't map on exactly,
Mm.
in that the techniques didn't always land. So the joke that I always use an example is when clients come in, Asian clients come in with difficulties with their parents, and clinician well-meaning goes, "You should move out," or "Tell them how you
Yes,
feel,"
I've heard
and
that
everyone
so
just
many
starts
times.
laughing because if you know, you know.
Yep. Hmm.
um, and then, so I make adaptations in my work and I work with my clients. I'm very privileged. I have the most wonderful, beautiful clients. And then I thought, well, I'm doing this. Are other people doing it? And
Mm.
for fun, Project Horizen started, and I spoke to 30 something odd psychologists, a lot of them from Shapes and Sounds. And I found out I'm not the only one doing this. Other people are doing it. So I thought, well, let's turn that into research, because to make true impact, apart from the workshops I run, which I can only train so many people at a time, it did unfortunately mean publication, because that's how you can leave a legacy behind in some
Yep.
ways.
Hmm.
And that is my journey into PhD land. And I'm now almost halfway through it and
Yay,
pushing
halfway
through.
through.
Yeah.
Yeah, no, that sounds so amazing. And like you've kind of like now touched on my next question for you about like what it means to integrate culture into schema therapy. Like your workshop is all about that. You kind of touched on it why as well, like how like a lot of the Western sort of like training does not really map onto the Asian experience. But yeah, could you speak a little bit more about like what that's been like for you and like what it really means to integrate culture into schema?
Honestly, the moment I started doing it, it just shifted things for me. And I actually found that I was enjoying work a lot more because it became more contextual. It
Mm.
helped me understand my client better. And for my clients, they felt more seen. And to feel seen, especially when you feel so othered or you're the minority is truly something that is indescribable. And so once I started integrating the work and putting into training, I recognized there's stages to it. So it starts with the assessment, and it meant I had to break from the mold of the stock standard diagnostic assessment that I had been trained in during my master's and actually ask more questions and recognize it's okay to take a bit more time. So the assessment is really important because that's where you're gathering all the important information. And if you don't ask, you're missing such a big chunk of it. And then it feeds into the formulation because if you don't formulate with culture and you leave it out, then you are missing such a big part of someone's identity. And when I talk about culture, I do acknowledge it is more than just ethnicity and race. My research itself does focus specifically on people of Asian heritage, but I also talk about culture in that culture is everywhere. Culture, there's so many different types of culture. There's subcultures, so neurodivergence, queer culture, sporting culture, organizational culture. It's unavoidable.
Yeah.
So this is not just something that is just for people who work with, culturally, linguistically diverse individuals. This is something I think needs to be applied across the board. And we recently saw that update in the code of conduct for across the Australian psychology workforce.
Yep.
And it's about time is all I had to say. But I think one thing that I always teach to my supervisees and at my workshops is if you don't have a solid formulation, and it doesn't mean that has to be a complete formulation because we're always updating it as we work, but we do need to have a certain lens, and part of that is including culture. And now it's one of the competencies. But if you're not applying it into your formulation and you're doing therapy, you're essentially just throwing techniques at someone and
Mm,
telling them to do it, but you're not truly understanding and linking it. So it's taking it to a whole other level in terms of how they experience therapy. So I think that's really been quite important and valuable. So I think that has shifted, integrating culture has shifted the way I do, I guess, conceptualize, the way that I do techniques, the way I ask questions, the way that I examine my own positionality and understand the privilege that I hold as well in sitting across from my client and how that might impact the way that they respond to me. So it's filtered through in so many different ways. And I guess the way I see it is the clinical is embedded within the culture, not the other way around, and not as overlapping Venn diagrams or those
mhm.
circles, because culture is all around us all the
Yeah.
time.
Yeah.
Yeah.
Yeah. The clinical is within the culture.
Yes.
Yeah. Yeah. No, I agree with that. Definitely. Like I think culture shapes the context of
Yes.
everything that we do. So it's like you can't really take it out of that context at all.
No, and it really shouldn't be an afterthought or a
Mm,
checkbox. It's so much more, and it doesn't. Yeah, as I mentioned, it's not just about client asking about clients' race and ethnicity because, for instance, a lot of my clients are really into gaming culture, and we talk about D&D culture,
mhm.
and so culture is everywhere. You just have to ask
Mm,
and find out and understand the values within that and how it shapes their experiences. And then it actually becomes such an asset because you can use that as almost a way to creatively supercharge the therapy, because then you actually have examples or metaphors that really resonate with them. And then it just makes the therapeutic process more
yeah.
enjoyable for
Yeah.
everyone.
Yeah, definitely. I'm curious to know then, like when you work with clients of Asian heritage, like are you noticing specific or like not specific, but like more kind of obvious patterns or like trends in like the kinds of schemas they present in and like how that might have like shifted your like how you practice schema as well.
Yes. So I've often, I guess, anecdotally shared in my trainings that there's
Mm,
like these common schemas that come up that all Asians, I say anecdotally, share, and that's the unrelenting standards, which is akin to like perfectionism. So that high pressured academia kind of focus and the drive. That's definitely present. Self-sacrificing, a bit very much prioritizing others' needs before our own. Um, Emotion deprivation, in terms of like not being able to necessarily always express emotions in the way that perhaps the Western world deems as this is a healthy level
Mhm.
of expression, and having the language to be able to label it. And then I think one thing that often underlies and drives a lot of it is the defectiveness shame schema, that sense of not enoughness
Mhm.
and feeling that there's something flawed within me, or that there's something wrong, or I'm inferior. And I think those tend to come up very frequently. I think there's also across different generations, like older generations. So the clients that I see, if I'm talking about clients in their 20s or 30s, and then they will share stories about their parents. And I can see that as a result of, let's say, the war and a lot of the experiences that their parents have gone through, a lot of them hold a negativity pessimism schema of expecting the worst, which in the context, if you're going through a war or going through a lot of adversity, makes total sense.
Exactly.
Which then is also coupled with a vulnerability to harm schema around fearing something bad happening. And then you look at the evidence, and literally they've been, they're refugees, or they've been forcibly removed from their home countries. You can understand why they would develop those
Mm.
beliefs. So I think there's across different generations, different trends, but I think there's also the intergenerational trauma that's passed down from generation to generation. So there's definitely kind of patterns I notice coming up within the Asian clients.
Hmm. Yeah, I think it's important, like what you touched on as well, like to contextualize where those schemas come from. Like they're not necessarily like maladaptive when they developed, like they might have played a role because like it's normal for people to have those, I guess, like if they have to anticipate like the bad things after experiencing war or whatever, like there is a reason where that schema came from. So I think, yeah, like what you touched on, like that contextualization of culture
Exactly.
is so
Yeah.
important.
And one thing I will note is it's easy to so quickly pathologize
Hmm.
culture and go, oh, that's a problem. But you have to examine the lens that you're viewing it through. And I think this is the thing where, let's say, a lot of characteristics of Asian culture, and for instance, collectivism, filial piety, um, that sense of duty, obligation, or familial sense, a lot of it in the context of an Asian family or within an Asian background, that's that's a core part of how the society functions. Just because someone doesn't understand it doesn't mean they should label it as, oh, that's problematic.
Yeah.
So, oh, yes, one thing that I did want to mention. So, one of the schemas that comes up a lot is this enmeshment schema, and that sense of, so enmeshment referring to when your sense of self is tied in very strongly to another person's sense of self. And so it's almost like it kind of gets merged into one.
Hmm.
And so a lot of people go, oh, you're enmeshed because you're so close to your family. Like that's not healthy.
Hmm.
But then what if that's the normal? What if, what is normal? I don't think it's fair for people to kind of jump in and go, that's not normal if you still live at home at this age, or
Exactly.
things like that when they don't understand. And I think that can actually then cause more shame, but also can cause internalized racism as well. So
Mm-hmm.
that it's very problematic for someone to jump in and label someone else's experiences without asking the questions and allowing that person to be in charge of their own journey.
Yeah, definitely. Um, I guess then, like, do you think that's kind of the main challenge you see that a lot of perhaps other clinicians report when doing kind of schema therapy with Asian clients? Like, maybe their Asian clients are always taking those really maladaptive schemas. But like it's like perhaps there is another way to understand that schema, not through that maladaptive labeling.
Yeah, definitely. And I think it's thinking about moving across the different views of self. So, more Western individualistic cultures prioritize more like that independent view of self, community, others are there to support and nourish the individual. Whereas more collectivistic cultures prioritize more of an interdependent view of self, where self is connected so much to family, community, and it's all about maintaining and preserving group harmony. Having said that, in this day and age, with migration patterns, with technology, with everything, um, it's never one or the other usually.
Yeah.
It's like, and I think this is why I really resonate as being someone of the Asian diaspora of living between worlds and
Mm,
fluctuating up and down between it. So I think there is something to the whole lived experience as someone who does go through their own challenges of trying to figure out how much I want to slide up and down the scale and then seeing clients go through it and then I guess creating space to let them know that it's going to always be evolving and fluctuating and you don't have to just pick a fixed position. It is about being very fluid and flexible and being able to adapt to the situation, honoring, I guess, your own values and what you want. And if that means that you want to actually focus on your family first and foremost, then that's the right decision for you. It's no one else's place to come in and go, no, you should look after yourself first. So
mm,
that they always say, put on your oxygen first before you help others.
yeah.
That holds across certain, situations, but for some people, they don't want to.
Yeah.
And just because someone told you that's what you should do, does that mean we should blindly follow it? So
Mm,
I think I'd like to give a lot of, I guess, agency and autonomy and respect to the wishes of my clients and what they feel is important for them and how they want to live their life, rather than going in and saying you're thinking wrong or you should focus on yourself more. That's something that I think you can explore with curiosity, but it's sustainable. Change isn't going to be there if it's not informed by the client's wishes and desires and how they want to allow their therapeutic journey to progress.
yeah. I think that's so important because, like, I think that really highlights the fact that with culturally responsive work, it's not necessarily like, oh, you need to know all the different factors in this culture. Like, someone who is East Asian will do this kind of thing. It's more so acknowledging that different cultures will do different things differently. So it's giving them the agency and like trusting that like whatever decision they're making is the most appropriate for their context.
Absolutely. And I think I missed a part of your question earlier in terms of what gets presented or shared in trainings or supervisees. And I think one of the challenges when we're talking about schemas and these cultural presentations is that one of the biggest feedback I got was, oh, I've done the training and I've gone out and applied it, but it didn't work. Like my client didn't
Mm,
react, and that's often because there's barriers. There's a coping mode, like we call it detach protector, where it's a emotional avoidant coping technique. So it's almost like the way I would describe it, it feels like there's a wall between you and the other person, and
mhm,
they're on autopilot. Or sometimes clients will also go, oh, when supervisors tell me about their experiences of doing some imagery scripting work, they say, oh, I went into the image with my client, or I tried to, but they said I couldn't, like they just couldn't see it happening, or they got angry at me for confronting their parent to
mm,
support their needs. What do I do? So these little like things aren't actually that little because it's so integral to actually having shift and change.
mm,
And so in my workshop, we talk about how to troubleshoot that and how to approach it and the steps that you can do to scaffold to give you I guess, a more hopefully positive outcome when you are doing the technique
yeah.
and to honor your own therapeutic style rather than trying to replicate that of whoever's training that you did. I think that it's very important to be
Mm,
genuine and authentic.
yep.
And I've learned that the hard way across my career in terms of like there's certain trainers who are very animated and very musical, and that's great and that works for them. when I try to do it, it does not land and it just feels fake. And
Yeah,
the clients, they will
they
see
would feel
straight
it.
through it.
Yeah.
They're like, what are you doing? So,
Yeah.
yeah, I think it's all about embracing who you are as a person, and your personality and how you bring that into the therapy room and making sure that it feels authentic and genuine.
Yeah, that's so important. You touched on a little bit about your research at the start of the conversation
Yes.
as well. So I just wanted to ask you about your PhD. Like you said, it's going well, and I'm glad to hear it's going well. But yeah, like you said, it's in schema therapy as well. So could you just
Yes.
talk a little bit about what you actually do in the PhD and how that ties into your workshop?
Absolutely. So my PhD is, I guess the title that I've given it is Transcultural Applications of Schema Therapy in Asian Heritage Populations. So there's a few different stages across it, but essentially what I'm trying to do is build a culturally responsive framework of practice for schema therapy. And at the moment, the research study that I'm conducting is probably the biggest part of my research. And what that involves is actually interviewing clients, so clients of Asian heritage who've received or are receiving schema therapy, about their experiences of finding a clinician and whether adaptations were made and how that's been going for them, what landed, what didn't land, as well as interviewing clinicians, so schema therapists who provide or are or have provided schema therapy to Asian clients. So all my research is qualitative. There's a really big reason for why I went down that pathway. It's not just because I didn't want to do statistics.
Mhm.
It's really because there are studies themselves that show there's cultural influences to the way that people also respond to quantitative um, measures. So, like Likert scales, certain cultures will always score in the middle. Some will score very
Yeah.
much on the
Yeah.
ends and either end. And so, I'm trying to think what is the best way to truly capture and to explore and get input from people about what challenges they have. Sometimes, using qualitative measures don't always capture that enough. So that's why I'm doing the qualitative research, because there's so much rich data that can be captured. I think the client experiences has been the core of it. There's a lot of research out there with protocols and adaptation models, and often they rely on experiences of clinicians and what they've noticed. And I think that's really missing such a core component, which is the client experiences. You should ask the people receiving the therapy what they
Yeah.
want,
Yeah.
not what the people delivering it think they want.
Yeah.
So that's why to me, that's been the most important part of it, is actually going straight to the community and actually inquiring with them, what what do you want to see? What has helped? What has worked? And building around that. So as I mentioned, I've started doing the interviews for that. It's been very enlightening. It's still at the early stages.
Mhm.
I've got a few publications that are in the works that talk about I guess, diversity across the Australian psychology workforce, and then a few analyses of, I guess, experts in the field who talk about what they think are gaps in the therapy itself and what can be done to mitigate that. And then down the track, I'll do another big study that actually builds the framework. So, been very busy to say the
Yeah.
least, and a lot of it feeds into the workshops I run, and everything kind of ties in. So
Mm.
it's been quite, I think, joyous for me being able to do this work, because I can see where it's going and see how it can benefit the community.
Yeah, no, it sounds like it's definitely going to make such a big impact for the community. And it's so important that you bring the evidence base into the work as well. Yeah, I really resonate with what you said about the qualitative research. I think it's so important to bring that humanistic side to like therapy research. Like there's only so much a number can say. And like what you said about like how people rate their like experiences on scales, it's like just even that like is such a Western concept. Like what are the kind of measures we're sending to these people? What are the kind of frameworks that are being tested under? Like that can oftentimes be so Western centric as well. So I think
Yeah,
like that's
definitely.
very, very important work that you're doing for sure.
Thank you.
Um, but yeah, like back to your training, for anyone who's interested, like where can they, what can they kind of expect from your training and like where can they find more details about it?
So the workshop itself has been refined because across the last 2 years of running it, I jam pack so much in because I just want everyone to have everything. So I've actually moved part of it online. So
Yep.
the first part is around assessment and formulation and the background literature. So I've shifted that to a self-paced online module that can be completed prior to the in-person attendance. And the reason I did that is so that the in-person workshop focuses on having more time to do the stuff that's really, really important, which is the experiential technique.
Hmm.
So there's more time to do imagery scripting and chair work, the stuff that makes many of us uncomfortable. But I find with practice and being able to do live demos, people get the most from it. So I've restructured it so there's an online 1.5 to 2 hour module, and then there's the all day in person workshop. And so in the morning part of it, I cover more of the imagery scripting. I do a demo of what just a stock standard imagery scripting by the book looks like, and then what a culturally adapted, culturally informed, or culturally responsive, whichever way you want to call it, imagery scripting looks like. And I do different ways of chair work in terms of how to address culture, how to modify responses when teaching clients things like self-expression or assertiveness in an Asian context, how that might look, and then also having a look at how to do some chair work that is about harmonizing culture and not pitting it one culture against another. I very
Hmm.
much don't like this idea of like opposition in terms of like causing a client to feel like making one choice means that they're neglecting the other important part of them.
Yep.
So I've modified some of the techniques to look at how can we align it in a way where, as I said to you, being of the Asian diaspora myself, I feel like I slide up and down a scale. And so
Yeah.
I've shifted chair work. So rather than it being opposing, it's like how up and down the scale you are, but it doesn't feel
Mhm.
like you're foregoing or compromising a part of yourself in doing that. So, and then there's other, I guess, smaller techniques that I've woven into it. But I think it's really getting people to truly think in a different way in examining their self positionality and where they stand relative to their client, to their colleagues. And really, it's about operating within a framework of cultural humility. Because,
Yeah.
as you said, we can't know everything about a culture, and cultures are evolving, and there's subcultures. And
Mhm.
I work across different types of populations where it might include international students, migrants, adoptees. And so, yes, whilst on the surface we may all look similar to an extent, we all hold very different stories. And it's important that as clinicians, we take the time to listen and hear those stories and not make assumptions, not have biases, and just just jump to labeling someone
Yep.
just because of the way they look or
Mm.
what their passport status is.
Yep.
And yeah, so I think that's really important. And it's really like if I can get people to come and take one thing away from it, it's just to stop and actually listen more and then reflect and do that with openness and humility. And if I do that, then I'm happy.
Yeah, yeah, that sounds so important and honestly sounds like a very, very amazing workshop that you're going to be running.
Thank you.
So yeah, we'll definitely link all of your details to the workshop in our show notes and everything as well, and like we'll put it on socials and everything.
Thank
But yeah, thank you so much for joining me today, Danny. It was great to chat to you. And yeah, for anyone who's interested in joining Danny's workshop, please sign up below.
Thank you so much. I hope to see everyone there. I'll be in Melbourne in November. And unless you'd like to come join me in Singapore, I'll be running it in Singapore in October. So I hope to see you all there.
Yep. Thank you, everyone.
Thank you.
Bye.